Okay, welcome everybody. I'm Susie Foreman from the Joint Pain Relief System. And for those of you who don't know me, I, along with my husband, Andre Gordon, run a program, an online physiotherapy and personal training program for people with hip and knee osteoarthritis. If you would like more information, the easiest way to contact me would be at my email, Susie, Suzie _Foreman, Foreman @hotmail.com. So, along with the program, I do every now and then interview other practitioners on topics related to hip and knee osteoarthritis. And today I have the pleasure of interviewing a colleague that I have worked with personally, and that is Dr. Morgan Winton. Now, Dr. Winton graduated from the Canadian Naturopathic,
Morgan,
please help me, College
the
in
Canadian College of
2003,
Naturopathic Medicine. Yeah.
right, in 2003. And Morgan currently works downtown Toronto. Her specialty is fertility, but she does have a broad-based practice, and of course is well versed in talking to us today about nutrition and supplements. When she's not working, Morgan has a young son, Charlie, who's about 12, 13 now.
12, yeah, good memory.
And she enjoys Pilates, skiing, hiking, all kinds of stuff. Whoops, I see a client is having trouble getting in. So welcome, Dr. Winton, and we will get started. So give me 1 second, Morgan. I'm sorry, I just got a desperate message.
No
Link
problem.
is not working. Okay. 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 Oops, one more person in the waiting room. All this administrative stuff killing me. All right. Killing me. Okay. Okay. So again, welcome, Morgan. And I'm going to get us started on just general discussion on diet, because diet does play such an important part with whole body inflammation, and we're learning more and more about the gut. So I'm going to just let you speak in general about diet and its effect on inflammation, especially when it comes to people with osteoarthritis.
Yeah. So I think it's really important to think about each person specifically rather than one subscribing to one type of diet, because every body is different. So some people feel less inflamed on the keto diet. Some people feel less inflamed on a vegetarian diet.
Right.
So I think it's really important to think about your body specifically. That being said, when we think about anti-inflammatory foods, we think about fruits and vegetables, we think about fish, and we think less, despite keto working for some people, we think less about saturated fats. We think about saturated fats as being pro-inflammatory. So, I generally suggest that people subscribe to a balanced diet, not too much saturated fat and red meat, thinking about more Mediterranean style, lots of fruits and vegetables, whole grains, fish, legumes, but again, keeping in mind how that feels in your specific body.
Right. Yeah. Actually, which brings me to, I know I have friends who are a cardiologist, and they talk very much like you about the Mediterranean diet and stuff. When we talk saturated fats and inflammatory, this is particular for me. Dairy. Can we touch on dairy?
Yeah, for sure. So we want some fat in our dairy to absorb the other nutrients that it contains, but cheese is full of saturated fats. So it's so calorie dense that for me it generally goes in that kind of occasional food rather than on a daily basis. I don't think that from if you're having milk and yogurt and those sorts of things. I don't think that it has to, I wouldn't do 0%. But I would think about, 2%, rather than a 7% yogurt or a 4% milk. So thinking about a lower fat, but I wouldn't go no fat.
Okay. Okay. I the reason I ask is because
Yeah.
I've been having cottage cheese and yogurt usually 4 mornings a week with fruit and
Yep.
chia and
Yep.
stuff. So I was just wondering, is that too much? Right.
Well, those are generally going to be lower fat options, right?
Okay.
Cottage cheese is usually maxes out at 2 or 3%. And yogurt, as long as you're not getting a super luxurious yogurt, I mean, you can get a 10% yogurt, but generally, again, most of them are going to be 2%. So I think that's fine. Yeah,
Okay.
that wouldn't fuss me at all.
Okay. And you mentioned, fruits and vegetables. Any ones in particular, if we're looking at inflammation? Any ones are
Really,
superstars?
Uh, I don't believe in a superstar. And I also don't like to preach a superstar food
Okay.
because I think variety is the spice of life. But I also think that whatever you're going to eat is going to be the best for you. So if I say broccoli is the best in the world and you hate broccoli, it's discouraging.
Right.
So any fruit and vegetable is a good fruit and vegetable,
Okay. Okay.
minus French fries, maybe.
Oh, come on.
I know,
Actually,
I know.
actually, hold on. Let's talk
Yeah,
French fries for a second.
yeah,
Um, I've heard that cold potatoes have resistant starch, which is good for
yes,
the gut. So let's talk French
yes,
fries for a second.
yeah.
How about we bake our French fries and then we make them cold?
Well, that doesn't sound very appealing to me. I prefer
Okay.
hot and deep fried.
Okay.
Um, but I think that there's other better ways to get good fiber and starches for the gut. And
Okay.
again, simply eating a variety of fruits and vegetables achieves that goal.
Okay. Now, I know this is a complex topic, but since we've mentioned gut, can we
Yeah,
touch a little bit on the gut?
yeah.
For instance, what is a prebiotic food?
Yep. So prebiotic foods are foods that have the good fiber and properties that will feed the good gut bacteria. So our guts are full of bacteria, good and bad, and we want to make sure that we have the nutrients to feed that good bacteria. So again, getting back to fruits and veggies, all that fiber really enhances the gut bacteria, or the gut microbiome, but also it's the variety that is very helpful, and it increases the variety of good bacteria within the gut.
Okay. Okay. Sorry. Excuse me for 1 second. Poor Hillary's having a hard time
Oh,
still coming in. Okay. Let me just help her get in. And then we'll continue with that conversation because you mentioned that word fiber.
yeah, one of my favorites.
Yeah, one of your favorites.
Yeah,
Okay. Um, so let's talk fiber. I mean, the recommended daily amount is 25 grams for women. I'm not sure what it is for men. I didn't
30,
pay attention.
35 for men.
Okay. And is
Yeah.
that, I know sometimes naturopathic doctors think that some of those daily recommendations are on the low side.
I would be thrilled if all my patients actually got 25 to 35 grams a day.
Yay, I'm doing well.
Yeah, it's really, especially with the trend towards a lower grain and lower starch diet,
Mhm.
um, it's hard to get. Honestly, it's hard to get. Fruits and vegetables are good sources, and they're great for your gut and full of antioxidants and all sorts of other things. But our highest and easiest sources of fiber are grains.
Right.
So I would say that a lot of my patients, I'm kind of preaching whole grains and fruits and veggies, trying to get them up to that 25 to 35 grams. And if you are increasing your fiber, do it slowly. Don't just jump right up, because
Mhm.
you'll either end up with stomach aches or constipated, because your body really has to adjust to diet changes.
Okay. And how about chia?
I like chia.
Okay.
I love making a chia pudding. Um, and it's a nice, easy source. It's got some good omegas in it.
Mhm.
It's a nice, easy source.
Yeah, I've taken to, like I said, I've 4 days a week just because it's easy and quick,
Yeah,
and I'm
yeah,
super busy. I've taken to cottage cheese and or yogurt in the morning with raspberries, blueberries, chia.
yep,
And I find that does give me a nice healthy start for my fiber. And then
yeah,
we're also avocado fans in our house. So
yeah,
so I actually am pretty good at getting my fiber count up. Okay.
yeah.
And we're talking about chia flax.
Flax is unless you're grinding it, it's hard to absorb. It's hard to absorb anything from flax unless you're pre-grinding it because those little, I don't know if anybody's bought flax bread or stuff like that.
Mhm.
Those little seeds are really hard, and there's no way we're chewing them up enough. So I do like flax,
Right.
but if you want to use it as a source of fiber, it's really got to be ground.
Okay.
Um, and
Okay.
then the worry is once it's ground that the oils are then exposed to oxygen and start going bad.
Mm.
So I always tell people if you're going to buy pre-ground flax, make sure it's in a vacuum packed
Ah,
um, container, not just in the baking aisle like you can find it at Loblaws.
right.
And otherwise, you can buy it whole and grind it in the blender or your coffee grinder or something. And then once it's ground, store it in the fridge or freezer, which will postpone those oils in the flaxseed from going bad.
Okay, interesting. I didn't know that. I myself don't use a lot of flax. I really have been using the chia.
Yeah.
And then we have some multi-seed carbonate. I don't know if you've ever heard of carbonate bread.
No, I haven't.
Um, yeah, it's a multi-seed bread and low carb. And so Andre and I like that. So we talked a little bit about prebiotics.
Hmm.
So let's touch on probiotics. I know the gut
Probiotics.
health is a large,
Yeah, it's
large
huge. Yeah.
topic to touch on.
Yeah.
So we'll just poke little holes at it.
Yeah. So
Right?
as I said, the gut is full of bacteria, both good and bad, and we're just always trying to feed the good, feed the good, feed the good.
Mhm.
And so one of the ways we can do that is by either eating probiotic filled foods or taking probiotics. So yogurt, kefir, there's non-dairy yogurts, kombucha, sauerkraut, kimchi.
Right.
There's all sorts of good probiotic food containing foods. Generally, they're fermented foods. That's what we find the probiotics in. And then there's a million different kinds of probiotic supplements that you can take. And I find that it's really person dependent, and what I'm trying to treat depends on what I choose, which specific strains and brands and all that.
Okay. You know what I've never been able to put my finger on because I know, for instance, that probiotics are the good bacteria in the gut. I know that
Yep,
prebiotics feed probiotics,
yep.
but how much? How much probiotics should we be ingesting, and how much prebiotics do we need to give them for them to stay full?
So I think that if we get back to that 25 to 35 grams of fiber and we're eating a balanced diet with varied fruits and vegetables, I think that probably we're getting enough prebiotic.
Okay.
Um, when it comes down to probiotic, I don't think we know.
Okay.
I don't think we know. And um, I'm usually not that particular about dose, interestingly, because when we talk about supplements, I'll be very specific about kind of doses used in studies. But with probiotics, I'm usually not that specific about dose. If you go too high, you can end up with some digestive upset for sure. But I don't know. And we also know that in any capsule, regardless of the quality of probiotic, there's going to be a chunk of the bacteria that's dead. So
Right.
even if it says whatever dose, I personally don't really trust it. So yeah, I guess I don't think we know, or I
Okay.
don't know for sure. I
Okay.
don't think
Well,
we
I'm
know.
I'm glad that you're honest because but I also like the answer about the prebiotic because um I like since they do need fiber, since the probiotics
Mhm.
need fiber, I like the fact that you say that if you get your 25 grams of prebiotic, you should be good in that department.
Yeah,
And
yeah,
then, like you said, unfortunately, probiotic, you don't know, I went and bought kimchi and sauerkraut, and I
Yeah,
don't mind them.
yeah,
It's just to incorporate them into what I typically have is not so easy.
yeah, for sure. But if you're having yogurt 4 mornings a week, you're getting a decent amount of probiotic,
Right,
right?
right,
You're going to be replenishing your gut bacteria 4 times a week. So
right.
you're probably not doing badly.
Okay. Okay, and supplements.
Hmm.
All right. Why don't we start there now? When I came to you personally for my own, I don't know if you remember my right foot, I have some arthritis in the midfoot and it was quite stiff. You
Yep.
put me on omega 3s.
Yeah.
So, would you like to expand a little bit about, actually, can we talk about all omegas? Can we talk 6, 3, and is there 9 as
Yep.
well?
There's 9. Yep.
Yeah, would you
Yep.
mind telling us the differences between them and what you suggest? Take this, don't take that.
Yeah. So I never supplement with 6 and 9.
Okay.
Um, we tend to get an overabundance naturally in our diet, and it's 3 that we're generally lacking. So we always want a balance. But I never even think of 6 and 9 because we're usually 3 deficient in comparison.
Okay. Help me.
Yeah.
6 and 9, what are they found in and are they good or bad?
Oh, they're fine, but it's a matter of it's
Balance.
all a matter of balance. Yeah.
Okay. Okay.
um, and they're generally found in our plants.
Okay.
Um, so we tend to get enough plant and not enough fish, really.
Okay. Okay. So fish, obviously salmon is a very good source. We mentioned
Yep,
chia is a
yep.
very good source of omega 3. Um,
Flax is a source.
Flax is a
Evening
source.
primrose oil, olive
Okay,
oil.
but
There's
okay, but would you cook with evening primrose oil or you just
no,
take it as a
you would take it as a supplement. But
okay.
on that note, as much as possible, I only supplement with fish-based omega 3s because your body on the plant-based omega 3s has to convert it into something it can use. And the fish-based or algae-based, there are vegan algae-based omegas
Okay.
now. Um, your body can just use as is, so it's going to be an easier source.
Yes, you put me on the Natracy lemon flavored, which I
Nutricy,
like.
yeah, yeah,
Nutracy, sorry.
yeah,
And I did find it about 2 or 3 months of taking it consistently. I
yeah,
did find the stiffness. I mean, it settled completely down in
yeah,
my right midfoot and really hasn't given me much trouble since. I have slacked off a little bit and not as consistent, but I'm trying to get back to being consistent with it. Right. And
yeah,
you mentioned, so there's the actual, you said you prefer fish-based oils if people aren't vegan.
yeah,
And actual natural sources would be salmon. I've heard sardines.
yep, absolutely.
Yeah. I'm not sure. I get the feeling that not many Canadians like sardines, maybe more
No,
Europeans. We like it as Jamaicans.
yep,
But
not popular here for sure.
right. And mackerel. Mackerel's a fish
Yep,
that's big in Jamaica.
yep.
Um, However, I do know sardines, if you have too much, I'm not sure about mackerels, can contribute to gout.
Well, actually, I didn't know that.
Yeah.
But I hesitate. Fish is one of the things that makes me a little bit sad in this world, because it's one of my favorite foods. I absolutely adore eating fish. It feels
Mhm.
so good in my body. I love the flavor. I love fish. Um, but I hesitate to ask patients to eat a lot of fish because our oceans are gross and dirty.
Yeah.
And we know that a lot of these toxins are stored in fat. So to be trying to eat the fat of a dirty fish is probably or potentially counterproductive. So unfortunately, omegas are one of the things that I do supplement more when I'm thinking about fish. The
Okay.
other thing is it's really hard to, like, people aren't eating fish every single day, and as I said, that's okay with me. But it's really hard to get enough omega 3s. We think of a standard dose from an arthritis standpoint at 1.5 grams a day, and that would be a lot of fish. And people aren't eating fish every day.
How many tablespoons or teaspoons would that be of an oil?
Depends. I want to say that it might be less than a teaspoon of the Nutricy,
Okay.
but it's going to depend on the concentration of the oil.
Okay. And now that's interesting. Unfortunately, as you said, our oceans are
Yeah.
What gross and dirty, was that the word you used?
That's, yeah,
Right.
that's my phrase for them.
But then farm raised, I hear, is not much better,
I agree. I agree. Yep.
right? I hear
Then
it's
we're
quite
full of
polluted.
color and antibiotic and all sorts of other things too. So yeah, I eat fish, I eat wild, I eat farmed, I eat it all because I love it so much.
Mhm.
But I think that really, I eat it because I love it. I don't actually eat it for the omegas.
Right.
If I want a source of omega, I go unfortunately to a bottle.
And what about seafood? Because, for instance, I'm into shrimp, I'm into lobster, I'm
Yeah,
into crab, scallops. I
yeah,
don't eat,
yeah.
I eat shrimp often, but not the
You're not
rest.
eating lobster every day.
Right. No, I would like to. Right. But yeah, I'm not eating lobster every day. Are they sources of omega-3s or not so much?
Yeah, but less so and higher sources of cholesterol.
Uh, okay.
Yeah.
Okay. And other supplements. So omega-3 is good for general inflammation. Is
Yep.
there any, oh, actually a lot of people now are turmeric and I can never say it.
Curcumin.
Thank you.
Yeah.
Right.
Yeah. So turmeric, you're kind of funny. I love using food sources, but turmeric, the curcumin is a aspect of turmeric,
Hmm.
and it's actually very hard to absorb. So tons of people just add turmeric to their smoothies. I don't know that you're actually going to get anything out of it.
Mm.
There's turmeric lattes. Again, I'm not sure that you're actually going to get anything out of it. So generally speaking, curcumin supplements have gone through a process to make it bioavailable.
Ah,
Um, yeah, so it's different for sure.
so that's good to know. That's good to know that people not turmeric get the curcumin and
Curcumin,
curcumin,
yeah,
sorry. Ugh.
yeah.
And I understand you have to put black pepper or some kind of pepper.
So black pepper is common to be found in the curcumin or turmeric supplements. It you don't have to have it, but it definitely can increase absorption. So
Okay.
again, it depends on the company and what they're doing to the turmeric, and then
Yeah.
whether they deem it necessary.
I remember David, oh, what was his last name? I can't remember, the sports medicine doctor.
Oh
He
yeah,
gave me a recipe. I should find it for my clients and put it on my Facebook group. A recipe for a shot,
yeah.
right? Um, and I think you could use coconut water, lemon juice. There's a little bit of pepper, and then
Some turmeric.
yes,
Yeah.
I right with
I
right
question whether you'd get anything out of it,
because if
but
it's turmeric, but I have to go back and see whether it's turmeric or can you buy curcumin?
no,
No. Okay. Okay.
no,
So then
no.
again, get whatever
Get
that
the
word is,
supplement.
get
Yeah,
that supplement.
yeah.
Okay. And the studies
Um,
have shown that it is good for.
yep, yep. I mean, you can always find a study to say yay or nay on anything that we'll talk
Mhm.
about today. But I did come across a study recently that it was 4 weeks long,
Mhm.
and the group was taking 500 milligrams 3 times a day of the bioavailable curcumin, and it showed that it was equal to taking ibuprofen or Advil.
Oh, wow.
Yeah,
So
yeah,
that's substantial.
yeah, yeah,
That's substantial.
yeah,
I do have clients on my program who are taking anti-inflammatories. It'd be nice to find
yeah.
a natural source because a lot of clients also come to me and they don't want to take pharmaceuticals, right?
Well, it
Uh,
eats at the gut.
right. And thankfully, though, a lot of people, as they get stronger, their pain comes down. The night pain usually
Yeah,
goes first,
yeah,
and then their function increases and their pain comes down. One of
yeah.
my clients last year came to me in agony just before Christmas, walking on a cane, 6,800 milligrams of whatever it was she was taking. By the end of it, she was down to 800 milligrams, and then off her cane, walking 30 minutes. I keep in touch with her regularly. We touch base, and she had a great summer of golf, and she
Oh,
was
good.
considering a joint replacement surgery next spring. And she said, Susie, I don't think I'm going to go for it.
That's amazing.
Yeah, yeah, yeah. I really like to all the clients watching. I really, as you all know, I'm very pro um, exercise, and we have control. We don't have to sit and take things. We have control. I realize everybody's at a different level, and so everybody needs to find what they can tolerate and build from there. Okay. And never ever compare yourself to others, because your story, your journey is different. Some people have had horrendous injuries to their knees. Others, it's milder, and people are coming in at different fitness levels. So never
Mhm.
compare yourself to others. And I really believe we all need to find where we can start and building it stronger. And I've watched my consistent clients settle their pain down and increase their function. Right.
Yeah, and all
Um,
the research shows that too, right? Just,
yeah.
whatever it is, whatever you can do, keep moving.
Yes, yeah, it's very true. The research does show that. I mean, out
Yeah,
of the research in Denmark, exercise far surpasses medication and or surgery for pain control.
yeah.
And yeah, yeah, definitely, 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 definitely. Um, yeah, now I have sent you a few patients, and this was really interesting. I sent you one patient, and you put him on Boswellia, which I'd
Yeah,
never heard about until I sent
yeah,
him to you, and you put him on Boswellia. So,
yeah.
can you tell us a little bit about what is Boswellia?
Yeah, boswellia is a herb, and it's known to be anti-arthritic. It's known to be an analgesic, which means
Hmm.
it killing pain, and anti-inflammatory. Um, and it's a neat one. Again, I found a study that was showing after 4 months on taking boswellia,
Hmm.
and this was looking at OA of the knee. There was
Right.
an improved knee joint gap. So we're seeing on X-ray changes
Really? So
that
you're saying that instead of the diminished joint space, there was actually, that is
an improved
interesting.
knee joint gap,
Okay.
and reduced osteophytes, so like bone spurs. And then also, same study was showing decreasing in blood work, C-reactive protein, which is
Hmm.
an anti or an inflammation marker. Yeah, so it's a neat one.
Right.
But important to note with Boswellia that it's best for OA and it's not ideal for RA and psoriatic arthritis
Okay.
because it can stimulate the immune system. And we don't necessarily want to do that when we're looking at autoimmune
Right,
arthritis.
right. Yes, in my program I only deal with osteoarthritis. I make it very clear in the workshop that I can't help anybody with an autoimmune. So that's
Yeah,
interesting to note.
yeah,
But I also find that very interesting that the images change.
yeah, yeah.
I find that very interesting. Okay. So Boswellia, and I guess the dosage would depend on what somebody's weight.
No, generally no. I mean, I usually start with study doses,
Mhm.
and study doses are generally at 100 milligrams a day. Sometimes I'll go higher than that. But yeah, generally study doses are at 100 milligrams a day.
Okay. How does one, I mean, we've talked about omega-3 so far. We've talked about
Mhm.
like that word I
Curcumin.
can't spell. Thank
Yeah,
you.
yeah.
All right. And we've now touched on Boswellia, but how does one know which brand is good of anything?
I
Or is
think
that
that
when we
you
need to see a
don't.
naturopath and get the
Yeah,
recommendation?
yeah, yeah. And some things I think it doesn't matter, and others I do.
Right.
Yeah, so it depends on the supplement. And even from supplement to supplement, I think about which company is doing a good job and at what price point.
Right.
Because some people have tons of money and others don't.
Uh, uh,
So I think it's important to think about price point as well.
right. And it's crazy because you can spend a
Oh,
lot, a
huge.
lot, a
Yeah.
lot, a
Yeah,
lot of money.
probiotics are a perfect example of, you could probably get a probiotic for $20 or you could spend $80. And that's a huge difference.
Right. Right. And
Yeah,
then, I mean, if you just have probiotics and then you have other stuff on top of it, the omega-3s to this,
yeah.
I mean,
Oh,
you're
yeah.
spending, two, three, $400 a month on just
Yeah,
on
yeah.
supplements,
And that's
almost
not the
more than your
goal.
food.
Yeah, yeah,
Back to eating proper food,
yeah, yeah,
right?
exactly.
Back to eating proper food. Okay. Now I know everybody watching, you're probably going to have questions. I'm going to save them for the end. And as I mentioned earlier, we'll put them in the chat, or if you don't know how to use the chat, I'll get everybody, whoever wants to speak to unmute themselves. But there are a few more supplements that I'd like
Hmm.
to talk about. Now, years and years ago, I think around 2003 was when I first started hearing about glucosamine and
Glucosamine.
chondroitin. And
Yeah,
I believe it came to us from the equine world,
Absolutely. Yeah.
right?
Yeah.
And I remember way back then, the medical doctors saying to patients, well, we don't have enough research to back it up and blah, 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 blah. But patients telling me it was mixed, but some patients really found it was beneficial. But now I believe the research is in favor.
Yep. Research is in favor. But it's interesting because there's definitely research that shows you don't need both. That generally speaking, you can do one or the other. So often a supplement will have both in, and it's fine. It's not detrimental.
Okay.
But we don't need to be looking for both in a supplement. Yeah,
Okay, so
and
that's interesting because usually they are sold as both.
yeah. And the research is mainly on hip and knee, but there is some research on hand OA as well, which I liked because it's not weight bearing. So for me, it was nice to kind of have a different idea about how we might use glucosamine.
Yeah, that's good because honestly, as a physio, hands are the most common joints affected with
Yeah,
osteoarthritis, and there's not much from a physio point of view.
it's
I mean,
hard.
we can give
Yeah,
you general hand exercises, especially the thumb.
yeah,
And now some people like compression gloves, but
yeah,
there's not much for
yeah,
hands. So it's nice to know that glucosamine chondroitin has been studied on hand
yeah,
arthritis,
yeah.
osteoarthritis.
It's also generally very affordable. But I will say clinically,
Hmm.
I find it hit and miss.
Okay.
I find it less, I find less consistent results with glucosamine.
Glucosamine. Okay. So
Yeah.
that's
Or
interesting to know.
glucosamine and chondroitin. Yeah.
I used to have my dogs on it,
Yeah.
right?
Yeah.
Especially after ACL surgery, and I
Yeah.
actually think it helped. I
Yeah.
actually think it did help my dogs. I had them on that as they got older. And then collagen. That's something
Mm-hmm.
relatively new. A lot of people are jumping on the collagen bandwagon, and
Mm-hmm.
marine collagen is what a lot of people are
Mm-hmm.
talking about.
Mm-hmm.
Again, I don't know the research behind it. I just know it's out there.
Yeah. So there was a couple of things to think about with collagen.
Mhm.
There's more than one kind of collagen. So there's more than one kind in the body, but
Right.
generally when you're looking at supplements, there's also generally there's two different kinds. So one is generally like it's called UC2 and it's undenatured, and the
Okay.
other kind is hydrolyzed collagen. So if you're putting like collagen in your smoothies and stuff like that, it's the hydrolyzed collagen, and your body is what that means is that it's broken down, and it's broken down into a pretty basic form, and your body can use it to
Okay.
hopefully build back up your own collagen. Whereas the undenatured collagen is acting like it's acting on your immune system. Even with OA, it's acting on the immune system to help target collagen cells, and it seems to still work. So although we call it all collagen, it's totally different doses. It's working totally differently. But there was on this UC2.
Hmm.
That's really in my from my research is where the better research is on it.
So that's a
Um,
hydrolyzed one.
yeah, no, that's the
That's the
undenatured. So
undenatured
it's
one.
not the
Okay.
stuff that you're putting in your smoothie.
Okay.
It would come in a pill format.
Okay.
Anyways, there was a meta-analysis of the undenatured collagen, and it was shown to be effective in improving OA symptoms, so decreasing stiffness and pain.
Okay.
Yeah, so I thought that was a good one.
Uh,
Yeah, so there is also research on the hydrolyzed, the stuff that you put in your smoothie,
mhm.
but I feel like it was less. There's less research. There's less
Okay.
backing it up.
And so it sounds like the hydrolyzed is to build back the collagen, whereas the undenatured is to work on the immune system.
Yes, exactly.
I like that better. Right? I can get my
Yeah,
patients to build back their collagen by weight bearing,
yeah, yeah,
right? By
yeah,
weight
yeah. You
bearing. So
can.
I like I like that it can work on the immune system.
Yeah.
The other day, I was the Arthritis Society of Canada also puts on some webinars,
Yeah.
and there are two things I'd heard of there that I'd never heard of before. So one was ASU, I think
Hmm.
is what it was.
Yep.
Are you familiar with that at all?
Yep. I've never used it clinically, but I am familiar with it. So it's avocado and soy unsaponifiable oil, which
Ah,
is why we just call it ASU. So number one, if you have any allergy to avocado or soy, you shouldn't be using it.
okay.
There's also people who have a latex sensitivity who have a cross reactivity with avocado. So watch out with that one as well. Anyways, when I was researching this, because that's what I like to do in my spare time, is
All right.
figure out what's actually going on with this stuff. There was some decent short-term research, and it was, one of them was saying that taking ASU was decreasing the need for NSAIDs, or anti-inflammatory,
Okay.
pharmaceutical anti-inflammatories, but that over the long-term use, a couple years out, there seemed to be no benefit.
Okay.
So maybe for some short-term pain relief, but really past 2 or 3 months, we're not seeing much happen.
Yeah. Sorry, you made me laugh a second there because you talked about people being allergic to avocado. And I grew up with avocado trees in my front yard.
Oh,
And so did
that's a
Andre. And so
dream.
we're like, allergic to avocados, you poor souls.
I know.
Right? We are so happy here. I mean, in Jamaica, we had to wait till it was in season. We're
Yeah,
so
now you
happy
can get
here.
it any.
Right. And we
Yeah,
easily go through 4 or 5 avocados a week.
yeah,
Right. Easy. So I feel sorry for people who are allergic to them. Right.
yeah,
So that's
yeah,
interesting about the ASU. That's something fairly new. Um,
yeah.
and then the other thing that they talked about that I'd never heard of was SAM E.
Hmm.
Yeah.
I've only ever used, I don't know about much about the use of SAMe with OA, osteoarthritis.
Mhm.
Um, I've used it more from a brain function perspective.
Ah, okay.
So I've never used it.
Okay.
Yeah,
Okay. Yeah, the talk that I first heard about it, the jury was out.
yeah,
That was one of them that may help. The
yeah.
jury was out for osteoarthritis.
I'll keep an eye
Okay.
on that one.
Now, have I missed anything, or we've touched on the
We've
main ones?
we've touched on the big guys for sure.
Yeah, the big guys for sure.
Yeah,
Okay. Well, I'm going to open up the floor. The chat is open. If I got sent a question. Oh, whoops. Here's one question that's come in. Do you know about serapeptase?
serapeptase.
Serapeptase.
Yeah.
Whoops. Where's that noise coming from? Is that's your kitchen or what's that?
Nope, that's not me.
No? Oh, whoops. Somebody needs to, okay, there we go. Okay. Okay, there we go. I was wondering, where did that come from?
So
Yeah.
serapeptase works as an anti-inflammatory, more kind of via an enzymatic reaction. So it's more like it's breaking down inflammation and inflammatory products. I feel like it's gaining popularity. I haven't looked into the research of it recently, but I know there is definitely some research coming out on it. But it's usually not my go-to.
Okay, because it sounds like it doesn't stop inflammation. It just lessens the
It's
inflammation once it's there.
it's more of a breakdown of the inflammation. Yeah,
Okay. Okay, interesting. Yeah, I think Hillary might have mentioned it to me before, but it's not something that I'm that familiar with. Excellent. We have touched on a lot.
yeah,
We've talked about in general about diet. We've talked about the effect of just your day-to-day diet on inflammation, the best type of diet. I mean, everybody varies. Like you said, some people flourish on keto, some
yeah,
flourish on vegan, but generally the Mediterranean diet is what's promoted. And we touched on supplements and stuff. So I'm going to open the floor um, to the people that are here in attendance. If you know how to use the chat and if you have questions, then please just put your questions in the chat. If you're not familiar with how to use the chat, then just unmute your microphone and ask. All right. So we'll give you a couple minutes to speak up. if you have any questions or concerns about anything. Nope, looks like we got a quiet crowd today.
Okay.
All right.
Oh,
Let's
did I
see.
touch
Oh,
on
whoops.
Boswellia?
Oh, yes. Somebody, yes, we did. Would you mind, Morgan,
I'm
just speaking
happy.
about
Yeah.
Boswellia
Yeah,
once
for
again?
sure. Ellen, I love Boswellia. And I love it because it both has anti-inflammatory as well as analgesic properties. So it should decrease inflammation and decrease pain. I also really like it because there's research that shows that there can be positive joint changes when you take x-rays 4 months after 4 months of taking it. So I love it.
Okay, excellent. So something I like I said, that those X-ray changes, that's good to know.
Yeah.
That's
Yeah,
good
it's a
to
neat one.
know. Because I've said to patients, for instance, when it comes to imaging, a lot of my clients or potential clients get really hung up. Well, my X-ray says I have bone on bone
Yeah.
and whatever. And I tell them repeatedly, look, don't worry about what your images say, because, people come to the program with 8 out of 10 pain. They work
Yeah.
on the program and the pain drops drastically, but I have not changed their imaging.
Yeah.
Right. So don't
Yeah.
worry about what your
Yeah.
images say, worry about how you function.
Yeah.
But it's good to know that I can mention to them Boswellia and to speak to their naturopath about it.
Yeah.
Okay, so Francie's asking, you can see it, eh? You can see the
Yeah.
questions in the chat.
Yeah. So Francie, the research was showing that it was equally that turmeric or curcumin, the bioavailable curcumin, was equally effective to Advil. So aspirin,
Is
I don't
different,
find many patients
right?
using aspirin purely for pain. So, and if they are using aspirin, often it's because there's also, heart issues or heart prevention stuff that we want to talk about. So I would say if you're just using it for pain, I would try it out. If you're using it for other things, I wouldn't substitute, if that makes sense.
Okay. Good. Whoops, here's a
Yeah.
question from Linda.
They are just honestly different. Thanks, Francie. So the question is, what is the difference between glucosamine and chondroitin? They're just different components of joint cartilage. Glucosamine tends to be the more common one. It's more widely available. But I mean, from an efficacy standpoint, we don't seem to see any difference, whether you use one or the other or both together.
Aha, I learned something new every day. I didn't know there
Yeah.
were different components of joint cartilage. I
Yeah.
know about these supplements, but not as much as you do. So I learned something new every day.
Yeah.
Boswellia versus topical frankincense.
So Boswellia versus topical frankincense, they're going to be working in totally different ways. So I find that topical treatments, naturopathically, are really more symptomatic relief. So you might get some pain relief from a topical frankincense, but I don't think you're going to get true anti-inflammatory or joint protective aspects that you would have taken Boswellia.
Aha, interesting. So you know what? You touched on
Mhm.
topicals and it just jogged my memory. Can we talk about CBD and THC?
I don't know. And so naturopaths aren't allowed
Oh,
to,
really?
weirdly, since we should
Right.
be the people who do it
Right.
if we're talking natural things, we're not allowed to prescribe nor discuss CBD or
Really?
THC. Yeah, I think it's naturopaths. I think it's too much of a hot topic for us,
Oh, okay.
or too much of a hot topic that
Okay.
they want to keep us out of trouble. So for me, the issue is then that there's not good, I mean, I don't think there's solid research on any of it yet anyways,
Right.
but there's not good learning resources for me because we're not allowed to talk about it.
Oh, okay.
So
Okay.
so I'm actually very uninformed.
Okay.
Yeah.
I've had one client who was a retired nurse. She found a topical of equal parts CBD and THC. She
Yep.
found was good for her knees. And so I do let my patients know that, listen, I can't, it's not my scope of practice, but this is what one client has found beneficial.
Yeah.
Okay. So Linda's asking if you can take Boswellia if you have osteoarthritis. Yes.
Yep. Research shows it's good.
Yep.
Yeah.
Okay.
And then homeopathics, arnica can be good. I use it more if like for an initial injury versus a chronic use. There's other combination homeopathics that I have used in the past, versus arnica. And then topically, Tromiel is a lovely seems to get rid of pain and inflammation and all sorts of stuff. But temporarily, again, I go for more of the herbs when it comes to thinking about longer term.
Okay, help me out. Homeopathic.
Yeah.
Help me. Is that the
They're
I've
the little,
heard.
yep, they're the little sugar pills.
Oh, what? Okay, so what? Hold
Okay.
on, but I think I've heard somebody talk about where it's like a drop, the essence of.
Yep, that's it exactly. Yeah. So it's a German system of medicine, and it says, so you take a substance and you dilute it so many times that just the essence is left.
Right.
Whatever that means, I don't know. I'm a science kind of girl.
Okay.
But I've seen it work. So I don't understand how it works. I have no idea. But I have seen results in lots
But
of
then can
different
you get
cases.
all these things that we've talked about, like all these supplements that we've talked about, can you then get them in the homeopathic version?
Not that I've seen.
Oh,
No.
okay.
Yeah.
Okay. So
Good question though.
yeah, so what are homeopathic things? The Tromiel is not homeopathic.
Yeah, Tromiel is homeopathic, and it's
Okay.
combination homeopathic cream. Arnica is a plant that has been turned into a
Oh,
homeopathic remedy.
okay. Okay.
Yeah,
Yeah. I mean, I've heard of homeopathy before, but don't quite understand it.
I don't know who does.
Okay. Okay. Excellent. Oops. Here, Hillary's asking, prescribe? She uses Arnica montana and more.
Yeah, yeah.
Yeah. Okay. Yeah, but you don't prescribe it.
I've never used arnica for osteoarthritis.
Okay.
I rarely use homeopathics, but I do sometimes.
Okay. Okay. Hillary's saying she's getting good results with homeopathy. Yep. Okay, well, Morgan, love you, love you, love you. You know that. Right?
Love you too, Susie.
I also love you. I mean, you just speak so directly and coherently and easy to understand and stuff like
Thank
that.
you.
So it has been a pleasure interviewing you today and catching up as well, just socially before.
Yeah. Yeah.
Thank you very much for
My
speaking
pleasure.
to people in my program. I will speak to you after, just if anybody's interested. I'm not sure whether you would be able to see anybody online, but I will speak to you
Yep, I
after.
do.
You
No
would be
problem.
okay. So if anybody's interested in speaking to Morgan and seeing Morgan as a practitioner, then you all know how to get me. Then contact me and I'll put you on to Morgan if you have any desire to work with her. I personally work with her and she's an excellent naturopath, and very straightforward, no nonsense. I like it.
That's for
Okay.
sure.
Excellent. Everybody, thank you. Thank you very much for joining us for this interview tonight. And Morgan, again, thanks very much for
My
allowing me to
pleasure.
interview you. Diet, supplements, inflammation, gut health, all of it is so important to all of us. Okay, I guess we're just going to sign off from here. Have a good afternoon, everybody. Take care.